joining us. I know that you've got a super busy day, and it's like I feel like at the beginning of the academic year, it's always very, very busy, like extra busy. So I really, really appreciate you taking time out of your day and hanging out with us for a little bit.
My pleasure.
Um, so this we're just like super casual. I think that like you know me well. We've had a couple of conversations. This is an opportunity for kind of everybody to ask some questions, get to know a little bit about the program and kind of how we roll here, but also dig into a little bit of healthcare compliance. So I think hopefully you all can see my screen. We've got the questions and answer box that I will moderate for us a little bit. A quick introduction of me. My name is Kelly Rodriguez. I still need to update this slide apparently with my name correctly. And I am the director of our Master of Legal Studies in our sports law program here. That is one of my favorite pictures at T-Mobile Park. The Mariners are on fire right now. We just had a really great run against the A's. We did not do so well against the Dodgers last week. So I know, right? David's in Southern California. Um, and yeah, that was a rough series, but that's all right. Different league, so it didn't hurt us too much. And I'm super glad you all could join us today. Feel free to ask questions. We will do our best to get to them. And ask questions about healthcare compliance, compliance in general. David's got a really great background in compliance more broadly in business, and I'll let him tell you all about that in a minute. Um, our My phone number and my email address is here. Feel free to reach out with any questions after if you have any follow-up, and I'll have that information at the end here also. So with that, David, I would love it if you could tell us a little bit about yourself.
Yes. So again, we both need to make updates. I have to update my profile picture. But
Yeah,
I'm
whatever.
David Figueroa. Yes, I'm currently the executive director of policy and awareness at Kaiser Permanente, which is a large multi-state national healthcare organization. If you aren't aware, and it's a long title, but essentially what that means is I oversee the policy creation for national, regional, and local policies. So that's everything from how we run the business to particular procedures that happen in medical facilities. So it's very broad, wide-ranging process, and we maintain the hygiene and work with all of our subject matter experts across our 300,000 employee enterprise to create and manage that. I also oversee professional development for our legal, regulatory, and compliance teams and own all of our governance documents. So like our code of conduct, our vendor code of conduct, our charter, program description, all those things that kind of encompass how we run our ethics and compliance department. I am the owner of and maintain the hygiene of that as well. Prior to coming to Kaiser Permanente, I've been here about 8 years, actually 8.5 years now. I practiced law as a litigator in Southern California, doing criminal defense, civil defense, you name it, I probably touched it. I even did a little bit of bankruptcy. So lots of litigation experience before coming to Kaiser Permanente and getting entrenched in healthcare.
Awesome. I'm curious if you can give us all just a little bit of insight as to like the transition between kind of like the legal, especially from a litigation standpoint, into compliance. What was that like for you?
Big change, big
Yeah.
change. The way I describe it to most people is as a litigator, it's always a fight. Even if you're setting up a contract and working with two parties trying to come as one in the middle, they still have their own perspectives, and you're trying to find some room to meet in the middle. And transitioning into a larger enterprise, and I'm careful to say it's not an in-house role because I'm not practicing as an attorney within KP, but I wanted to find a role that allowed me to work seamlessly in the same direction with my stakeholders and partners. And that's precisely what I get working for Kaiser Permanente. It's like we all have a shared mission. We're all working to help our members stay healthy, to empower our communities to take care of their health. And while there's some disagreement, we're always kind of directionally going the same place. We're not trying to meet in the middle. And that's the biggest shift for me personally, and what I was really looking for as I wanted to pivot out of being a litigator.
Yeah, it's actually kind of a really cool pivot to the next kind of question. So when we look at like from law to compliance, talk about maybe like the other side of that coin, right? Like the business side, what it means to take the business acumen. So many of our students are not trained. I mean, they're trained in law, they're not trained as lawyers specifically.
Mhm.
So what does it look like when you look at the when you look at business but through a legal lens, what does that mean from a healthcare compliance? Like what is healthcare compliance?
Sure. So I think at a high level, legal skills or legal training is transferable into anything. I think working with other lawyers that are practicing as attorneys or in compliance or regulatory positions, I think the level of detail in their approach to problem solving is really the key tactical skill that they bring along with them. But in terms of the transition and how it feels different than being a litigator, obviously you have one clear client who is your organization, right? But you have many different sets of stakeholders that you're trying to empower as you're doing the work, especially in healthcare. So we have, if we take the example of maybe employer sponsored coverage, you have your organization, who's the healthcare organization. You have potentially, let's say they work for Seattle U. So you have the employer group that might be sponsoring or partly sponsoring the coverage of their employees. You have the actual employee who is your member who's paying, monthly dues to be a part of your healthcare system, and then potentially a family member who's on their plan. So it could be a child or a spouse. And so there's many different sets of stakeholders you're thinking through in the compliance space. How do we empower each of those people and what are their roles and responsibilities when it comes to the care of the individual? What are the business needs to make sure that we can stand up, a healthcare organization that is profitable? Even though I work for a nonprofit, if it's not making money, you can't run the enterprise, you can't pay your people, you can't give them the care that they need.
Yeah.
And so you're really the amount of stakeholders that you're thinking about in your daily practice is significantly larger. But I think the problems feel, at least for me, much more significant and meaningful in the work that I do. Especially when I was a civil litigator, it was like you lost money. If we lose the case, you lost money. That sucks. You can make more. But
Hmm.
here, if someone is like not getting the care that they need, are they going to still be able to live healthy lives? Are we going to empower them to be the best version of themselves? If we're thinking about something with the ACA, can they get care that's culturally competent and in the language they can understand? So I think the challenges can be just as complicated one place or the other, but in terms of getting meaning for the work, I think it gets no better than healthcare.
Yeah, I think that some folks, they see the word compliance and it's like, oh gosh, them again, right? Like the no people, the compliance folks are out to get me. They're going to tell me what I have to do and like give me a checklist and tell me what, how I should do my job. And I I think hopefully if we're doing our job well, we're listening to our stakeholders and we're trying to get to yes, right? We're trying to help them do their
Mhm.
job in a better way while still obviously like being informed by best practices and regulations and all of these other things. What if how do people misunderstand compliance when what is it not when people are misunderstanding your work?
Yeah. So I don't even think it's a misunderstanding. I think what your framing is exactly right, but what it maybe was 5 or 10 years ago. And I think the compliance field overall is facing an evolution about how do they partner better. We don't want to be the internal cops of an organization, the know people. We want to partner. We want to understand business problems and help design solutions that not only comply with regulatory concerns, but also help drive the business in a way that is successful. And so I think that's something definitely that's a focus on me is culturally, how does compliance show up in partnership with other parts of the organization? How do we protect them? Because as you get deeper, there's lots of civil liabilities that could be applied to not only corporations, but also individual leaders if they're not acting in a way that's in compliant with regulatory um, compliance issues. And so we want to protect those individuals, but also empower them to do their jobs in a way where they feel confident that they can do the work, whether it's sales or down to delivering care to members, but in a way that they feel comfortable that they're not at risk, they're not hurting their patients, and there's no guardrails on giving them the most effective care.
Yeah, no, that's great. That's really cool. So what is anybody who works in like anywhere in the legal sphere like hates this question. What does a day in your work life look like?
Yeah. So, due to COVID, I work remotely, so that's helped a little bit with sort of managing time and work-life balance. I'm able to be around my wife and my kids a little bit more, but essentially, I log on about 8 o'clock, kind of check some emails. And as an executive, I'm in a position where I'm not that close to the work. I'm sort of mobilizing my teams to do a lot of the detail work. So I'm in meetings a large portion of the day. But essentially, what my focus is on hygiene of our policy process. So kind of checking in on what policies are in queue that we're working on. Are there policies that are overdue? How do we escalate to get action on those policies that might be overdue? How are we communicating anything that's recently published to our workforce so they understand the new rules that they may need to be following? I'm working in partnership with our communications team to make sure we're communicating. As I mentioned, we have about 300,000 employees. And so making sure they're all aware is a really big challenge. And, it's part of my title, policy and awareness.
Hmm.
So I have to make sure everyone knows what they're doing. So that's a lot of partnership with our internal communications team. I'm frequently working on what else? Understanding new regulations as they come in. So that's partnering with our regulatory teams to intake new regulations and see are there impacts to policies. So lots of meetings throughout the day, probably between 8 and 4. I'm in meetings 75, 80% of the day. In between that, I'm kind of checking emails and then thinking about creating sort of at least 15% of my day. I'm thinking about that professional development piece that I own is how do we engage our workforce and help them learn about what's new and on the horizon? How do we help them be prepared for the next step in their careers? And so we're designing internal trainings and classes that help our professionals learn and do more and get better at their jobs. So they're, ready to, whether that's an individual contributor role to continue to progress or go into management. And so I try to carve out 15% of my day to look at other webinars that are in the
Hmm.
industry and what are they teaching folks about and how do I bring some of those things internally to Kaiser Permanente?
It's so interesting. I hear a couple of themes that when I'm chatting with other compliance professionals, one of the things that I've heard from another, I, this person is an assistant athletic director for a school that's in one of not the Power Five conferences, but right below that. And they described that first thing log on and looking at anything that's happening, like all the headlines, like what is the NCAA putting out in regulations, right? Like just taking it all in and then by the end of the day communicating it all out, right? It's like how do you synthesize and then communication. And I think, I mean, this well, that's something that we focus on a lot in our program, right? Like how are our students learning to synthesize the law and how are we teaching them to communicate it out? Because that's such a big part of being a compliance professional. And certainly there's drafting policies and drafting procedures and checklists and everything that comes in between that. But that is so much of what we do as professionals.
Yeah.
Um,
And I think getting agreement, right? Because if you ask legal and regulatory compliance to take a look at the same regulation and develop a point of view, they may not all agree.
mhm,
And those are frequently the teams people are relying on to say, what do I need to do? There's this new policy. I work in marketing or I work in sales or I work in business development and I don't know what to do. So compliance, legal, regulatory help me. And so we need to be on the same page and aligned about what the regulation means, what we might have to do about it, and what's the timing on it. And so there's a lot of prioritization that comes in. Is this something we do today, tomorrow, a month from now, a year from now? But yeah, that alignment across functions is an increasingly challenging but important piece of a compliance professional's job.
yeah, for sure. Let's see. So there's a question, and I'm going to try and read and synthesize this. So since COVID-19 happened, there are a lot of folks who have lost work, and unemployment payments have not been enough. And although there's still employment or work that is hiring for others, um, they're not giving up opportunities for former employees. So what's the best legal healthcare compliance practice for this matter? I'm not entirely sure exactly what the question is getting at. It sounds like how are we addressing, like how is healthcare or are there healthcare uh solutions in addressing some of the gaps for folks who are unemployed, like because there is a huge gap in obviously for folks who are unemployed there's a huge gap in healthcare. I don't know if you have
Yeah.
thoughts on that.
Yeah. So I know at least at Kaiser Permanente, we have um, sort of we think of ourselves as a plan that people can keep throughout their lives. So we design like member journeys where we think about someone maybe starts with Kaiser Permanente when they're on their parents' plan as a youth. And then as they get older and they graduate college, they get in the workforce, we might help them transition into a plan that's on the marketplace. And so we have communications that are tailored to individuals exactly where they are in that journey and help them transition and understand, hey, maybe you're enrolling for healthcare in the first time. And so we kind of help guide them in that journey. And then maybe they get a job and then they're looking at employer sponsored coverage, or as the question asks, if they lose a job. And so we monitor who might be at risk and help guide them into whether it's Medicaid or other types of plans that might cover them while they are experiencing a job loss. We do a fair amount of charity care where we waive costs of coverage for people who need critical care. But really thinking about members where they are in their journey, and every important touch point from when they're born all the way through end of life care. We try to support members where they are and give them access to resources. Another thing that we've done is partner with some external organizations to create community resources. We know that health doesn't just take place in hospitals. We think about, exercise, mental health and well-being, access to healthy food. And so we connect members with resources to get things that are outside the health system that might support them in their journey. And we make a lot of these things available to our communities, whether or not they're KP members.
Yeah, that's awesome. I think one of the things that our students work on is we have a capstone course at the end of the program where, truly like the world is your oyster. You can do almost any project that's compliance related. And a lot of our students will end up putting together some sort of curriculum piece or educational component. And I imagine, right, just kind of like thinking as both a teacher, professor, and compliance professional in my head, I think there's a big gap, right? I just launched one of my kiddos to college, and there's a big gap where students are kind of transitioning into young adulthood, and we don't teach them a lot about how to do insurance. Right, like
Right.
the insurance is this huge gap, but all of a sudden you're like off your parents' insurance, and my kiddo will be on my insurance for a little bit, but like how do we educate folks like in their youth, or like because you'll transfer insurance when you transfer employers or as you're going through your life, probably a few times at least. And I wonder if there is opportunity for more education for young folks so they can navigate this. Yeah.
Absolutely. Yeah. Another emerging space in healthcare is health education. That's, I think, within the last maybe 15 to 20 years. And I think the thing that Kaiser thinks about that, which I think is great, is we don't think of it as our members' problem. It's our problem,
Yeah.
right? That our members they don't do this stuff every day. They don't have access to these systems. If you're not enrolling for coverage, you wouldn't know what you need to do
Right.
or what kind of coverage you need, or, if you're a high utilizer or low utilizer. And so I think it is incumbent upon health systems to, again, meet members where they are, help them understand what their options are and what they might need to do, because people who end up not having coverage or not enough coverage are not just high cost for themselves and put themselves in, maybe precarious health or financial situations, but it's also a cost to the system and other users because, we have tons of data, and it's like the top 10% of your costs are like 10% of your user population. They're either high
Oh, wow.
utilizers or they're not using care the right way. For example, if they're going to the emergency room and they could be going to urgent care, which is
Hmm.
much more expensive. And so we want to get communications to people to help them understand the systems. And if they're not doing it all the time, of course they wouldn't know how to do it, right? So I think there's a big challenge on health systems to help people in their journey and understanding, what they need to do and how to do it the right way.
Yeah, that's awesome. That's really cool. I was raised by a first responder, so I'm kind of a bruiser.
There you
I've been
go.
to the ER a few times. Um, so I'm curious, you talked a little bit about the professional development component. Let's see. And before we get to that, we actually have another question that actually dovetails really well with the previous slide. So the question is, as a part of your role, do you have any opportunities to impact policy development at a state or national level? That's a really good question.
That's a really good question. So in my role, I don't, but we do have an internal government relations team that works with state level legislators, local legislators, as well as federal legislators. So we have people who are frequently in Capitol Hill really advocating for policies and guidelines that help our members. I think that's especially important role now in an election cycle, right, where that's coming up because healthcare organizations in general are always a little on edge as elections are coming because things can drastically change for how we go about care, how we go about communicating to members. Everything kind of feels in flux in an election cycle. And so
Totally.
we're definitely our government relations team is empowered to communicate, to advocate for what works best for us as a system, but also our members because frequently they don't have a voice, in on Capitol Hill or in state legislatures.
Yeah. No, I mean it's huge, right? Like not only is it are things in flux in an election year, but it's a really big issue. It's a huge cost to citizens, right? Like healthcare is huge.
Yep,
And when folks are not adequately insured, when they don't have access to insurance or when they don't have the right insurance to meet their needs, like it is a huge cost to them. So that's awesome.
absolutely.
And this question goes right along with what I was going to ask you. So I'll just ask a question. What are the skills to highlight when you're going into healthcare compliance when you don't have a professional history in healthcare? And I was going to ask kind of as a follow on, what are the skills that you look for when you are trying to develop your team? Like when you're looking to provide professional development opportunities for your team, what sort of things are you trying to bring to them?
Yeah, so I'll focus on compliance specific skills and I think general practical skills. So from a compliance perspective, even if you aren't a compliance professional, which I wasn't when I transitioned from the legal world into healthcare, I didn't have compliance specific background, but I think the compliance things that you're thinking about are um, just general awareness of the rules and regulations around the business of healthcare. So that's understanding like where the money comes in. So that's what we call the payors of care, whether that's employer sponsored, an individual getting their own coverage, the government in the case of Medicare or Medicaid. So just foundationally understanding who's paying for care, and then who are the recipients of that care, and then how the different insurance models work. And that takes time. I don't think you need to go into an organization understanding that, but definitely if you start in a new organization within the first year, those are the things that I would focus on is how does the business of healthcare work? And that's going to help you design compliant solutions around particular pieces of laws or regulations. If you don't understand the business, you can't make rules that govern it. That's the way I would describe it. And in terms of functional skills, I think most things can be trained, but I really focus on communication skills. That's always an important piece. Can you write well? Can you briefly, right, communicate to someone what they need to do, what they don't need to do? And this doesn't mean even writing policy, right? If you're just writing emails and you can't effectively, quickly get to the point of which you need someone to take action on, it's going to be really hard for you to do your job. So communication skills are of utmost importance no matter what kind of role you're in. I also think about being a good reader, and I think anyone with legal training or legal studies training is definitely adept at close reading, looking at fine print, reading a regulation, and just understanding and interpreting it in plain English. Because I think that's what we're called on a lot by business professionals is saying, I see this regulation. Can you translate it into English? I don't know what it's telling me to do or not do. There's subsections and there's
Mm-hmm.
bullets and colons, and I don't know what it all means. So being able to do a close reading and synthesize in plain language what it means. And then the last thing I would say is building relationships, and I think of that differently as communicating, right? Because it's easy to say we need to do one, two, three, but getting someone where compliance is in their day job, but trying to empower them to think about compliance affecting their day role, why it's important. Especially like one of the things I also do is I help design our annual compliance training. That's a requirement in the healthcare space that they get trained annually on the rules governing healthcare. And getting people to take that training is a pain. They say, I took it last year. Why do I have to take it again? What's changed? What's new? And so building strategic relationships where you can tell people, hey, this is really important. Can you tell your friends like why they should do it and they should do it early and not wait till the deadline? Because then it saves you from tracking down people at the end saying, please do this. It's a condition of your employment. So relationship building is an ever amorphous but challenging and necessary skill, I think, in any workforce, but definitely in healthcare as well.
I have so many thoughts right now and I like need to get them out quickly before they lose them. But So you hit on so many things that resonate, right? So in the program, we talk a lot about communication. Obviously, I've harped on it a lot today. Um, one of the things I'm reminded of, so David teaches our healthcare law class, and I'm not super familiar with all the regulations that touch healthcare, but um, it provides an overview of some of those regulations that do touch healthcare. But if you zoom out a little bit, one of the things that I like about our Foundations of Regulatory Compliance class that like a lawyer could not do when they graduate with their JD, I couldn't do when I graduated with my JD, even though we're taught to like litigate or read the law or whatever. Our MLS students are taught to read the law in a really different way. And we have this assignment where our MLS students break apart a big law, a big regulation into its component parts, right? Um, it's kind of difficult to describe, but it really does like teach our students to break apart a regulation in a way that then allows us to communicate it out to stakeholders in plain English, in a way that it just kind of highlights the difference between a JD curriculum versus an MLS curriculum. And they really are just two different ways of looking at the law. And in the MLS is such an operational degree, right? You're really taking these skills back into business and communicating them to stakeholders in a way that a JD student just is not trained to do. The other thing that you reminded me of, David, is Microsoft. I know the person, I can put you in touch with them. They built their required training in the format of like a sitcom,
Mm,
and folks were like glued to it, like waiting for the next week's release. So there's an idea for you for next year.
yeah.
Yeah, apparently it was like all the talk around the water coolers. So it was
That's
highlighted
awesome.
on the news over here. It was really
Music
interesting.
to a compliance person's ears.
I know, right? I
Compliance
was
being the
like,
talk of the town.
yeah. Um, so yeah, no, I really appreciated that. I love, those are some really, really great skills. Communication is absolutely key. Synthesis and being able to communicate out to stakeholders is truly at the core of what we do. So um, I don't see any other questions. Certainly, let's see, I've got the community or our contact information here. I've got communication like right at the forefront of my brain right now. I almost said communication again. So our contact information is here. Feel free to reach out to me if you have any other questions. David, I cannot thank you enough for your time today. I really, really appreciate having you just chat about healthcare and compliance in general. So
Absolutely.
any final thoughts?
I love healthcare. I think it's super important. But I think the skill set that at least for the classes I'm teaching in MLS is definitely transferable anywhere. The functional skills I talked about will, I think, set you up for success. I think you already talked about Microsoft and in the sports realm for any kind of role, any kind of career. But if those three things I talked about, communications, relationship building, and being able to synthesize things quickly, I think will help any of you professionally in anywhere you want to go. If you ask any of my students, a lot of my assignments are focused on you're writing a memo to other executives. You only have 2 pages, not because you probably could write more and have plenty of citations, but business people don't have a lot of time. And so, can you tell them in 2 to 3 pages what you need them to know is super important. I don't know there's some other educational practices that are like, we want a 10-page paper with MLS, citations and this. And I'm just like, give me 3 pages. What do you have? What do you know? So I think those are the imparting words I would have on you is being able to do those three things really well.
Well, thank you so much, David. That's great. I really, really appreciate your time and all of your wisdom. So I will let you get back to your day, but I really appreciate everything. Thank you all for joining us. Feel free to reach out if you have any questions, and I hope you all have a really great rest of the week.
Thanks.
Thank